Dr. Lee, I want to talk to you about dentures. Actually, specifically, I want to talk to you about dentures. There was some news lately that lots of people, they get loose dentures, and they become loose because the bones start shrinking. And most people think, of course, that their dentures start getting loose, but no, it's their bones shrinking. It's like, your trouser stays the same. You're getting fatter or thinner, so it, doesn't work. Your trouser really stays the same. And the same is with the denture. It doesn't get bad. It's your bones which shrink. But it's a whole different topic. But the point is, because of this shrinking, people need denture cream quite often, and they don't go and realign it with the dentist, so it's easier, cheaper, so they think to put denture cream in it. Besides the fact that it must, I don't know, it just must be not comfortable to put cream in your mouth and have it all over the place. But apparently there's been lots of news out there that this Fixodent dentures, creams and all that stuff have too much zinc in it, and it goes into the blood vessels, and people get nerve damage. I have seen pictures of people who their nerve damage was apparently, they were mentally and physically not complete vegetable, but boy, you surely feel very sorry for them. Now, it's not 100% proven that it is this cream, but the point is it could be. And what's your take on that? And what's your solution on that whole thing?
Well, the biggest thing is, even for our denture wearers, we'd like to have them come in once a year, just to take an x-ray once in a while to make sure that they're not developing any abnormalities in their jawbone. We want to make sure that the gum tissues are still healthy. If you have loose-fitting dentures, if they start to rub in certain areas on the tissue, it can actually cause the tissue to overgrow. Just like if you were to work certain parts of your hands a lot, you'll start to get a callus. Your body will react to irritation and trauma there. Sometimes those overgrowths can become cancerous, and something we don't want that to happen, of course. A lot of people find that they don't need to wear too much of the adhesive and creams if they get their dentures realigned properly. Kind of on average, every 4 years, you lose about 1 millimeter of bone. So, by not having your teeth in there or implants in there, you're going to start to lose a little bit of jawbone every year. Your denture is still the same. That hasn't changed, like you said. It's going to be the bone that shrinks. And, regular visits to the dentist, even if you think your dentures are feeling okay, should be done. Because there's things that we can see that you might not be aware of because your body has gotten used to it. Regarding those creams, like you said, Fixodent, I think they pulled their formulation and they've come up with a new zinc-free one because, anything, if you get too much zinc in your body, it can cause problems, like you said, nerve damage and whatnot. So, good thing, they pulled their product and they've changed it up there. But those patients that have those loose-fitting dentures, they might end up squeezing half a tube in there just to try to make it stay somewhat. But nothing's really a substitute for getting it fit properly. It's like if I have a size 10 foot, but I'm wearing a size 15 shoe. I can't work with it too well. I won't be able to walk with it well. So those patients who have the loose-fitting dentures, they don't chew their food as well. They don't get the nutrients out of them that they should. So, they might get digestive problems because they're not being able to chew their food properly. So,
for people who haven't heard about this, maybe this denture problem, which mine might have been out there, and mine might be fixed. But first of all, it couldn't be comfortable. Any glue couldn't be comfortable and couldn't be too healthy in my in the mouth, especially at the gateway of the blood vessels, in my opinion, but I may be wrong there. The point is, should those people, let's just say people have dentures, people have used denture cream, should they kind of like go and if they feel fatigue, if they feel tickling in the extremities, in the finger, in the toes, and if they feel muscle weakness and stuff like that, should they go and check themselves into to the primary care physician, who then probably gets them to a nerve doctor to get tested? And should they definitely go and do something about their denture, immediately thereafter?
Yeah, you should definitely go see a physician if something's not feeling right with your body. In regards to the mouth and dentures, as the bone starts to go down, sometimes the denture gets really close, to the nerve that's running down inside the jaw. So they might just get these burning pains in their mouth or some other kind of neurological issue there. So, go to your physician, have yourself checked out physically and make sure that there's no major problems there. Come to your dentist, get yourself evaluated, make sure we know where the nerves are in your mouth and if the dentures are affecting that. Every few years you might need your dentures relined. It's just kind of like everything else. Things happen really slowly, so you get used to, you learn to kind of adapt from there. Mm-hmm. But, at some point something needs to be done, and it should be done early before something happens there. Good. You get any ill effects.
Right. Now, let's talk about something else here. And, apparently there's, I call it the hybrid denture these days. Basically, you get a couple, 2-3 implants placed and you put your denture on it. Sometimes, apparently, you can even put your original denture on it if they haven't been, too worn out in the first place. But, and that apparently completely eliminates any denture cream forever. It eliminates to a high degree the shrinking of the bone. They apparently sit in there well and basically eliminate most of the denture problems denture people experiencing. Tell us about it.
Yeah. So, when you have a full set of dentures, whenever you chew, they're going to rock around and they're going to move. We found that denture wearers they only have less than about 20% of their chewing force. So about over 80% of their chewing force is gone, and they're not able to chew effectively. Once you get some implants placed, like you said, place the implants, and we can either retrofit your old denture to sit on top of there or make you a new denture if you need one. You can basically get 100% of function right back, because the dentures don't move. They act like your own teeth, and they're solid and stable, so you don't need any more cream after that.
Now, when you say 100% of the function back, so let me ask you, with an implant-supported denture, well, number one, you don't need no cream, which must be an ugly thing, never mind that it could possibly be poisoning, but forget about that part. Can you bite into an apple? Can you chew on a spare rib?
You can eat what you want. They're locked into the implants and they're not going to come out. You just go ahead and you just snap them out of there, just to clean them, and you put them right back in afterwards. So you will be able to bite your apple or your spare ribs.
Wow. So that's almost kind of like if you would be having a full kind of like set of implants, except a lot cheaper, I suppose.
Yeah. Yeah. For patients that don't have a good bone quality, we might just place 2, 3, 4, 5 implants and just snap the denture on top of that. And it's a good solution. They're already used to wearing the denture, but now we make it rock solid so they get 100% of chewing force back. And the patients we've done that for, they love it. They can eat what they want now. Their digestive problems have gone away because they chew up the food better. They might feel a little more energetic because they're getting all the nutrients that they need. So the overall quality of life improves as well.
Well, they feel younger again. I mean, imagine a person who has been wearing dentures, or let's just say hasn't been, but is at that crossroad of needing to make that decision. On a normal 4th of July barbecue, which is coming up, I guess next week here, he can go and bite into that apple, bite into that rib, and people around him don't know that he wears dentures because of he can eat. Do you know what I mean?
Yeah.
Or like I have heard from people who wear dentures that they're afraid of laughing because it may come out. Now, it might never come out, but when you have the feeling like your shoe is falling off, it might never fall off, but you have that feeling. It's just not comfortable. You know what I mean?
Yeah, I can tell you, I had one patient specifically, she told me she was in the church choir, she was singing, she sang that real big note, and in front of the whole congregation, her upper denture flew out of her mouth and hit the floor. Very embarrassing, not something that I would give her an option to maybe place some implants so that doesn't happen again. But yeah, I can understand that can be embarrassing, and they don't want that to happen. So it restricts, it restricts our emotions basically as well.
Well, yeah, because once you're afraid of that something might possibly happen, even though the chances are 1 in 20 years or whatever, you know what I mean?
Right.
But once you think it will happen, you will start holding back. Just like people who don't have a too nice of a smile or a breath smile, and they start talking like that, and it just, and they don't even know it anymore. After a while, they think this is very normal, always being like that. You know what I mean? So, absolutely wonderful. So you say that implant-supported denture, I call it a hybrid kind of, really it brings it pretty much back to your normal teeth, because what more is there than eating an apple?
Yeah, I mean, you get 100% of the function back, and what more can you ask?
And that for much less money than all kinds of, than many implants. A little more expensive than a normal denture, but a lot less expensive than the other one. Right.
And, we can kind of work with the patient and figure out between their finances and, the quality of bone and, how many we can kind of get away with at the bare minimum, so we can get them something. So not every patient needs the same number of implants. It really just depends, and we can figure that out between us and the patient.
Beautiful. And maybe you can even build up, give him two a few months later. I don't know, whatever. I'm not, but
it's possible.
It's all possible, huh? Good.
Yes, it is.
Or at least go on some type of layaway plan, kind of saying, okay, this is what we need to do over the next year. Let's make it happen. Yeah. Right. Because we live long these days. It's beautiful that we do. But we should not, because of that, the last 40 years live like, the old people. The nice thing down the road, I mean, way ago, the old people only lived another few years with their dentures and their stuff. Now you got to live a long time with it.
Yeah. Yeah, sometimes we get some older patients, they might be in their 80s, and they say, I mean, is it really worth it for me to, if I'm going to live for 5 more years, is it worth it for me to, get something like implants done? Well, if you're only chewing at 20%, it's kind of like saying, do I want my knees to only be working at 20% and I'm going to hobble around for the next 5 years? Or do I want to be able to, run and do whatever I want and enjoy my last 5 years, So it's not really a matter also of, how much longer am I going to live? It's like, how well do you want to live?
Right. No, absolutely. I mean, in fact, it can be constantly proven that we might sometimes say we want a long life, but what we really mean is we want to be relatively active. We don't want to be bedridden, and we don't want to be, we want to, or we kind of like, we can't eat that anymore. That's what young people are afraid of. They kind of say, I'd rather die before I, cannot eat my steak anymore, or my this or my that. When it comes to that level, they might not feel like that, and might still want to live without the steak. But the point is, be as much social, because that's what it is all about. Thank you very much, Dr. Lee.